Hello, my name is Kenneth and I am with Group 20. Today we are going to discuss the do's and don'ts of antibiotic usage. So please consider the following scenarios.
Hello, are you the pharmacist?
Yes, welcome to Walgreens. How can I help?
I need this prescription filled for my antibiotic.
Okay, what has your physician tell you about this medication?
Nothing. I don't even know what antibiotics are.
Okay, no worries. I will provide you with some of the information you need to make sure that you're taking your medication correctly.
Okay.
So basically, an antibiotic is a medication that rids your body of bacterial infections and should therefore not be used for viral infections. Each antibiotic has a unique way of working. Some antibiotics directly kill the bacteria, while others simply prevent the bacteria from reproducing.
Really? So, what exactly are they used for?
That's a good question. So basically, it is important to understand when to use and not use antibiotics. Like I said before, antibiotics are only effective for bacterial infections. It's not wise to use them for viral infections, such as cold, flu, runny nose, sore throat, cough, or bronchitis symptoms.
Okay, I get all that, but what's the big deal? Isn't it just like any other medication?
Although it is a medication, it bears some consequences. Resist, Such bacterial resistance can pose a problem. For instance, almost 2 million people get infected with antibiotic resistant bacteria each year, which therefore leads to roughly 23,000 people dying each year from this problem.
Wait, what's antibiotic resistance?
That's basically when the bacteria develops immunity to a certain antibiotic medication and it then passes on its immunity to its next generation. To stress how important this is, antibiotic resistant bacteria can cost at least $1.3 billion a year to the healthcare system. This is mainly through hospitalization from the misuse of the medication.
So, is that my only risk?
No, not at all. That's not the only risk. For instance, misusing antibiotics means that diseases that were once is treated become increasingly difficult to cure. So, as you can imagine, this is not a good thing.
So, how does a person misuse antibiotics?
That's a good question. Some examples are people basically not taking the medication like they're supposed to. For instance, taking the medication, they stop basically taking the medication once they start feeling better, or they share the leftover of their antibiotics with friends, relatives, and also those are just a few examples, but this can all be avoided just by following the directions that your physician wrote the medication for.
So, how do antibiotics get misused?
Well, typically the physician will sometimes write for antibiotic prescription before receiving the lab results, and sometimes physicians do get pressured by patients to write for medication to treat their symptoms, and usually amoxicillin is what's usually typically prescribed. Also, in regards to the patients usually typically take leftover medications from previous illnesses, or they sometimes use their friends or relatives' antibiotic.
So, what can we do to fix this problem?
This can all be prevented through patient education. So basically, there was a study that was done to help determine how effective this will be. And there were three groups in the study. One didn't receive any education on antibiotics. The other received a brochure about antibiotics. And the last group watched a educational video about antibiotics. So they were followed up in 4 weeks with a survey. And basically, the results of the survey showed that the group that watched the information in regards to informational video in regards to antibiotic, the best out of the other groups.
Wow, I didn't know this medication can lead to all these problems.
Yes, indeed. So basically, the good thing is that there are methods that have worked in regards to helping solve this problem, and I'm gonna show you three ways that has been taking place. So basically, there are three ways that have proven effective regards to helping solve this problem. So there are other ways to help resolve this problem, such as working together with the patient through patient education, working with the physician and pharmacist, and through education of hand washing hygiene, advocating for flu shots yearly, and advising the patient not to share or take prescriptions that do not belong to them, and preventing the use of antibiotics for viral infections. So basically, that is all the information I have regards to antibiotics for you. I hope this does shed some light on what the medication is used for and how to prevent its misuse.
Yes, doc. I learned a lot. I learned I need to follow my doctor's directions for the medication. I learned how to store the medication correctly, not to self medicate, and also to take the medication like I'm supposed to. Don't skip any doses and finish all the medication like prescribed. Thank you so much.
You're welcome. So I'll go ahead and fill your prescription, and I hope this information was beneficial to you.
Thank you.
You're welcome. Have a good day.